In today's Health Watch, how diabetes in pregnant women can damage their babies. There's a new report examining more than 56 million pregnancies. It found that children born to women with diabetes had sharply higher rates of ADHD and autism. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health News and joins us to sort it all out. Celine, good to see you. This report, very unsettling and disturbing, I would imagine, for a lot of people, especially if you're pregnant right now. What is the link between the two?
Well, what we saw in this compilation of numerous studies, so it's over 200 studies with over 56 million pregnancies that they looked at, they did see an increased risk of ADHD, autism, and other neurocognitive issues among babies born to women who either had gestational diabetes, so the diabetes you get during pregnancy, or type 2 diabetes, which they may have had prior to pregnancy.
Why is it so dangerous for the baby and the mom?
Well, we know that high blood sugar levels during pregnancy can cause other neurological issues. So, for example, spina bifida, we know, is associated anencephaly. What's probably happening is a combination of the blood sugar levels themselves, but also how that triggers inflammation, other hormonal changes, how it turns certain genes on and off during fetal development. And then also, it does increase the risk of having a baby who is larger, more overweight at the time of birth, which means that the birth delivery itself can be more complicated.
So should you get screened for diabetes before trying to conceive?
Well, this is a great question. And this relates to some of the cuts we've recently seen at the CDC. Nice. One of the cuts was the people in the Maternal and Child Health Division. The division got cut, by the way. The people in that division who were developing guidelines for contraception for women who had underlying medical issues, who are medically complicated. And so for those women, your regular birth control pills, et cetera, may not be the right thing. And so if you're somebody who has diabetes or some other medical condition, they should be trying to hold off on getting pregnant until those conditions are under control, whether that is diabetes or something else.
Those cuts will make a huge difference. Huge difference. A lot of people concerned about that as well. We always thank you.